We'll start letting people in. Is everyone, any questions before we get started or anything?
Thank you, Joe.
Awesome. All right.
Good.
We're letting them in. Admit all. Go. I'm gonna mute everybody too. Hello, everyone. Thank you all so much for joining us on this Friday call. As you are coming in, we'd love for you to introduce yourself in the chat. So if you could say your first and last name and the organization you're with, and we'll get started in just a second. I'll be adding the agenda into the chat as well. So just give me a second to add the link and we'll get started in just a minute. All right. Hello, everybody. Thank you all so much for joining us. Please continue to introduce yourself in the chat room with your name and the organization you're with. I'm going to get us started because we have a tight schedule and I want to be sure we use up all of our time. Cara, could you introduce yourself and we'll get started with the updates and move on?
Yes, sounds good. Welcome, everyone. I'm Cara Elliott-Ortega. I'm the Chief of Arts and Culture for the City of Boston. I'm going to run through our public health update and then hand it over to Emily quickly from Mass Creative so we can get to our main event today, which is going to be hearing from the ART and the Healthy Buildings program at Harvard. So I know we want to leave as much time for that as possible. So just starting with our health update, there have been 10,589 confirmed cases of coronavirus in Boston. 2,882 of those have fully recovered and 486 have passed away. The number of COVID-19 patients in Boston ICUs is decreasing. It's decreasing slowly, but it is decreasing. And that's an important stat to share with you all today because the ICU numbers are one of the measurements for reopening, regaining that capacity so that the medical system is not overwhelmed. So that's an important change in numbers. But while that is going down, Boston's average daily new cases have also started to level off. That number has been hovering just above or below about 150 new cases a day in this past week. And there are some indications that that number is going down. So this is important. It's still not, the number of cases is still not decreasing, but that leveling off is a big change as we've been seeing that curve flatten over time. There's still a lot of progress that we need to make before the city can launch a recovery plan, but that measurement for reopening in some cases is going to be seeing those numbers decrease over the course of 14 continuous days. So we'll probably start to see as we level off or plateau or hopefully start to see those numbers decrease, we'll probably see them reported in that 14-day format because that's how some decisions will be made going forward. I do want to make some time for just going over details from the mayor's press conference that just happened. Maybe people have seen this, maybe you haven't seen it yet. The announcement just now was that parades and festivals will not take place in the city of Boston this summer, up to and including Labor Day, which is September 7th, 2020. No event should be planned that would involve more than 10 people gathering or that could draw a crowd of any size. So we just got this news, and we're going to be working to just make sure that we understand. I mean, it seems pretty straightforward, but that we understand what that means, that we understand what that means in light of any other state restrictions being lifted or adjusted on May 18th. If you have specific events that you need information about that are going to have to be canceled, or where you just want more follow-up from the City of Boston, please email us, and Pascal can put her email in the chat for that. If you need more details, just let us know. We're still understanding the impacts of this fully. And I know everyone is really anxious for next steps in conversations on reopening. We're going to be working hard over the next few days, this weekend and early into next week, to identify a path for getting feedback from our arts and culture community. The city has identified arts and culture as an industry that needs particular attention and support. So that may look like a listening session next week, potentially during our normal Friday call at this time, to get more detail about what your concerns are for reopening, what you need in order to plan, and what you need in order to follow public health guidance. And we're trying to do this quickly so that we can have something in place for the 18th, even though we don't know yet what that state level of restriction is going to be at that point. So this is going to kick off a process where I hope that we can continue to leverage this forum that we've created together on Fridays to create a feedback loop between us, between the Office of Economic Development, which is really leading a lot of the recovery conversations, and with the health from the public health expertise from the Health Commission and Health and Human Services. One thing I just wanted to add from our update last week on summer jobs, because I got some questions. So I just want to go over the basics. If you're interested in participating in the summer jobs program, it is for youth who are employed between July 6th and August 14th. It's ages 14 to 21. The city does pay for youth wages, but it does not pay for your other overhead costs like supervision, extending anyone's hours in your organization to supervise youth. Now, that said, if you have the potential to hire youth and you need just like a little bit of money to extend someone's time, to pay for some staff time in order to do that oversight, please let us know, because we might be able to make a case or find other sources of funding to help support that if it will create youth employment opportunities over the summer. So I would say what we need in order to follow up on that is what that cost would be and how many young people would be able to be employed by leveraging that extra investment in your organization. And again, that will be Pascal's email address, which is in the chat. And there's a question from Kelly Gifford. If museums, culture orgs can open this summer, we can't have an event. Yes, I think that is what this is saying, that you could not have an event even with social distancing, but I will say this is an evolving situation, and this is a statement that's been kind of blanketed for the summer. So we're gonna have to do a deeper dive on exactly what this means, how it gets updated, if there are opportunities to update it, and I'll have a better report for you on exactly the implications for next week. Okay, let me go to the next slide. I want to remind everyone that we are having a second virtual forum on pre-K through 12 remote learning and arts education and creative youth development. This will be a follow-up to one that we did a couple of weeks ago. And the idea here is to get an update from arts education and BS, make sure that we're doing peer-to-peer support for people who are providing remote learning, distance learning. And it's been really interesting because in the last one we heard a lot about lessons learned, a lot of different platforms that people are using to keep students engaged, to do creative work online as a group. So please RSVP. We can put the link in the chat, maybe Pascal or Christina. And that's Monday, May 11th at 1:30. Great. And I think with that, I will turn it over to Emily.
Thanks, Cara, and hello all. I am just as looking forward to ART's presentation and the School of Public Health's presentation as you are, so I will be brief. So really quickly, federal updates. So we are expecting to see a House proposal next week, maybe, on a fourth stimulus bill. We expect that it'll include state and local aid. It'll also include money for testing, money for people. So they're looking at the earned income tax credit and the child tax credit as mechanisms through which they can get more dollars to individuals across the nation. Senator McConnell is also pushing really hard to make sure that business liability protection is included in whatever the fourth stimulus bill package might be. As this is coming together, we're also seeing a number of sign-on letters that are being circulated to raise the issues that need to be included in this fourth stimulus bill. So Representatives Pingree and Price put together a sign-on letter for members of Congress to join in their support for the needs of the arts and cultural sector. That includes funding to the NEA and the NEH, as well as dedicated funding for nonprofits through the PPP program so that they're able to get the money, and to raise the eligibility for the PPP program to organizations with more than 500 employees. So I just want to note and flag that Congresswoman Ayanna Pressley, Congressman McGovern, and Lynch all signed on to that support letter. This is there's a hyperlink in the thank them. It is just as important to make sure we are clearly asking for things as well as thanking our representatives when they do things that are in support of what we're looking for. So if you have a moment, drop I believe it would be Congresswoman Pressley, all of us in the Boston area, a line and let her and her staff know that you appreciate their good work on this. Next slide, please. So moving to the state. So I know unemployment liability and the issue of nonprofits needing to pay back unemployment, unemployment assistance that employees that are furloughed or laid off have claimed is a big issue for all of us. So I want to let you know that Senate Bill 2651 in Section 6, it includes a 120-day delay on repayment of the liability that for unemployment may have. This bill looks like it's going to be headed to Baker really shortly. It has not obviously passed in time for the April 30th quarterly repayment deadline. So here's another ask that I have of you today. If you're an organization that finds yourself in this situation, please share with me any communication you're receiving from the Department of Unemployment Assistance. We are working in partnership with a couple of folks, including the Mass Nonprofit Network, to try and source and see how the department is communicating on this issue so that we can appropriately manage our advocacy and work on this issue. So please feel free. You see my email down on the bottom of the slide. I am open and interested to hear what you are hearing. Then just a little briefly, so as we talked about last week, the Governor Baker stood up a reopening advisory board. They are expected to have recommendations ready before May 18th. Already they did a preliminary report. There is an open comment form. So if you feel that you would like to make sure that the advisory board hears from you or your industry or your organization, you can click on that hyperlink and it'll take you to an open comment form. We understand that already a couple of cohorts of arts and cultural organizations have presented to this group, including some of our larger museums, and then some of our venues are expected to do that as well. That's really great, and I think it's also really important that we as organizations and representatives of the sector also share what are the things that we're going to need, as well as what are the ways that we feel like we're going to support a safe and healthy reopening of our Commonwealth and economy. The other thing that happened is Governor Baker has issued, not just Governor Baker, the administration has issued new guidelines on businesses that are included in the essential services list. This includes flower shops and bookstores. I bring this up because bookstores we consider them part of the cultural space and cultural ecology. So you can hyperlink to the complete list of essential services. You can also see that there's a hyperlink to the review, what's needed for operation guidance. So you have to look at both of those documents to make sure that you are you feel confident in terms of that you're included in that class and that you are following the very, very important and very strong guidelines around how you can do your operations. So those are my quick updates. I'm going to defer to the presentation, but if you have any questions or additional things you'd like to follow up with me on, please, my email is right on the slide now, and I am happy to take any questions through email. Thanks a lot.
Awesome. Great. Thank you so much, Emily. Let's go to the next slide, and we'll, Carl, would you like to introduce our guest, please?
Oh, Emily, is there any health insurance update?
Oh, hey, do you find yourself in a situation where you need health insurance because because you've lost it or you're not able to pay your premium? I'm going to keep reminding us they have extended the deadlines through May 25th. This is an incredibly important part of keeping us all safe and healthy, and frankly, part of the supports that we're trying to advocate for to keep our community protected. So if you know someone who finds themselves in a situation like this, please click here for more information. I will continue on for a couple more weeks on this front. Thank you.
Thanks, Emily. Great. So we're excited to have Diane Paulus, the Artistic Director at the ART, and Joe Allen, the Director of the Healthy Buildings Program at the Harvard Chan School, here to talk about this roadmap for recovery and resilience for theater. And I'll just do a little housekeeping before we hand it over. If you have questions, we're not going to do any raising hand function during this bit. You can save your questions for the end. We'll have time for some Q&A, or if you have questions as we go, you can add them to the chat, and Pascal and I will help field those once the presentations are over. And with that, a big thank you to Diane and Joe.
Hi everybody. I thought I'd just start before I pass this over to Joe Allen to just give everybody a sense of how this came to be. Joe and I got to know each other over this last year. As I think many of you know, the ART is planning for a new facility in our future, and the location's in Alston. We were creating some think tanks around what a new arts building could be, should be, aspirationally, in terms of all its values. And
sustainability and well-being and health had become very much of a theme for us at the ART. And Joe, who he'll tell you about it himself, runs the Healthy Buildings program at ART, and he generously joined us to advise us as part of a think tank to discuss what a healthy building in terms of an arts facility could be. So we were working on that project, and when the pandemic hit, I had called Joe because our costume department was starting to make masks, and Joe had been in the press and on CNN and USA Today talking about masks, and I just called him to say, you know, what should we know about masks? How can we do this responsibly and well, and what's the proper communication piece around them? And that led to a conversation of the work he's been doing during this pandemic, helping businesses think about reopen, and that led to my saying, well, maybe there's a roadmap for the theater that you might be able to help us with. So that launched a series of conversations that his team has been having with our ART team. Really, the concept behind the roadmap is to think through guiding principles, the approach that we want to take, and scenarios for what we should be doing when we reopen and how we can be prepared for that. And I think what I've learned from Joe is there is no such thing as the foolproof solution. This is not a quest for the zero risk scenario. It's really about mitigating risk, and he'll speak to that more himself. But it was very illuminating, I think, as artists and administrators and producers, we don't often think about public health in terms of our facilities and our operations. And for someone who's spent his life in it, it was encouraging to hear that he had hope and optimism as well as realism. So it's a framework. It's going to be a living document that will be continually updated as the science is evolving. And we really wanted to undertake this in the spirit of offering anything that we can to help the field. All of you are colleagues in Boston, and of course, offering this to the field at large, nationally, internationally, anything that we could think through and take advantage of because of our particular relationship to Harvard and these amazing scientists. How could this be information that we could get out to the field? So more on that, but I think one of the first things Joe did for our team was give us a kind of a primer. He said, do you want a primer on this? And we all said yes. So we thought that might be a useful exercise for our time with all of you on this call today. So I'll pass it to Joe Allen.
Okay, thank you, Diane. And thanks, Cara, for inviting me to participate with this. And thank you to all. I appreciate the opportunity to talk with you all about this idea about how we can get back to restarting the economy and the arts safely. So I really appreciated this work that we've done with Diane over the past year, and then even more recently, and her entire team, Deron, Mariaron, Rebecca. It's been a real nice partnership. So first, I want to start maybe just tell you about my background, maybe hopefully convince you that I'm a good person that you should listen to, or we've been in this before, and there's actually a framework we can use that's grounded in science. So I run the Healthy Buildings program at the Harvard Chan School. I'm on the faculty there. I've been there for 14 years at the school, 6 years on the tenure track. But my full title is I'm a professor of exposure science. So what is that? Really, I work on how to understand exposure and risk mitigation. And in my field happens to be the indoor environment. I'm the deputy director of our NIOSH Education and Research Center for Worker Health and Safety. NIOSH is the National Institute of Occupational Safety and Health. I'm a certified industrial hygienist. Industrial hygienist, this is our field where we work on how do you identify, anticipate, assess, and importantly, control hazards. So I mentioned that as my background. This is the field I've been in for a long time. And even though I've been on the faculty for 6 years full-time, I've been with Harvard for longer, but primarily before I was full-time, I was in consulting. And my job was to lead forensic investigations of sick buildings. And so I've done this for a long time. And I've done hundreds of sick building investigations. I've seen everything I think that can go wrong in a building, radiological hazards, chemical hazards, physical hazards, and then biological hazards. I've done infectious disease outbreaks in hospitals, which actually reminds me of this in a lot of ways. Of course, the pandemic is nothing like any of us have ever seen. But in all of these scenarios, be it a school, a hotel, a hospital, in many cases, people had died. Many were at risk, if not everyone's at risk. Huge financial stakes, and then a really low information environment that's changing fast. And in each time, you have to apply the basics of exposure and risk science and make the best decisions you can with the best available data you have, and being flexible and adapting, trying to both mitigate the right now, the next week, the next month, and even longer, thinking about resiliency. So while the pandemic is new and unprecedented, at least in our lifetime, there's something that feels really familiar to me in the stakes, right? And I share this with Diane, that my personal philosophy is I follow the precautionary principle, put health first at all times. And I shared with Diane what my personal gut check is on any time I did any one of these forensic investigations was before I gave the all clear, my last test was, well, what if my wife worked there? What if my kids were in that school? Would I have given the same answer if that was the case? So I still ask myself that anytime I'm doing this work. So, all right, that's a little bit of my background and maybe philosophy, but maybe we'll talk just about the basics of disease transmission, because importantly, if we start there, then the control mechanisms that we're thinking about make sense. Otherwise, it can feel really, in my opinion, chaotic. There's so much to think about. So really for infectious disease transmission, right, we think largely of three modes of transmission. The first is large droplet. So this is if I cough or sneeze, the large particles that will settle out relatively quickly. Sometimes you can see spit. Sometimes you don't see large particles that settle out. And this informs strategies like physical distancing, or wearing a mask as a physical barrier. Second mode of transmission is what we call fomite transmission. A fomite is any inanimate surface that can act as a source of transference for the virus. For example, a doorknob or a hand railing. The third one is airborne transmission. So if I were to cough or sneeze, there would be large particles that settle out, but then smaller aerosols, fine particles that stay aloft, could be for several hours. So there's evidence that all three modes of transmission are happening here. The relative difference is unknown. We may never know this. We still don't know it for influenza, believe it or not, after studying this for decades. It's also totally irrelevant to the conversation, because if I told you fomite was 5% or 10% or 1%, we'd still want to tackle it and address it in our buildings and theaters. So, so the idea is we throw everything we can at this, and the control strategies then align with those modes of transmission. Even though we think about three modes of transmission, it's a totally false construct. Because in that example, if I cough or sneeze, I will generate large particles that settle out, large droplets. I will create fomites, and some fraction will remain airborne. So even though we break them up, it's a full-on continuum. It's very much a false construct that dates way back. For another time, we could talk about that. So, so what we know about buildings historically is that they can either aid in the spread of disease or act to prevent or limit or minimize that hazard. I'm glad Diane started with there's no zero risk, right? And we know from historical examples that's the case for measles, the other earlier coronaviruses like SARS and SARS-1 and MERS. And there are many examples of high-profile outbreaks where the building did not perform. But the good news there, and I've been writing about this since early February and pushing out op-eds on this, is that buildings can be the front line of defense in our strategies to minimize risk. Buildings in a larger framework of overall controls. So if you wouldn't mind putting up the slide I sent over, I want to share a framework I've been using that I think is helpful as a way to think about the strategy for mitigating risk or minimizing risk in buildings. And it's the good thing here, it's called the hierarchy of controls. And the good thing is it's not, Joe's idea just made up over the past couple of weeks. The hierarchy of controls is something we have used in worker health and safety for decades. And even for chemicals in a factory, you name it, this strategy applies. I wrote about it, and I put the link here so you can see it. It's published in Harvard Business Review as of last week if you want to read the details. But really, it's actually quite simple conceptually. There are 5 parts to the hierarchy of controls. The first part is you eliminate the hazard. In this case, that would be working from home, staying at home, doing remote administrative or even early rehearsals. So you try to eliminate the hazard, but that's not really the path back for us long-term or restarting the economy. Second thing is substitution. So can you substitute activities or personnel where just the core people have to go back and maintain all of those other strategies like physical distancing, but you limit the number of people that are there. The third in the list of the hierarchy is engineering controls. These are healthy building strategies. Increase the ventilation rate, higher efficiency filters. And so there are these things we can do in managing the airflow around the, in and around the, in the building or in the back of the house and throughout the whole theater, managing the airflow in the bathrooms. Fourth is administrative controls. And the idea here is, well, how do you de-densify the building? How do you utilize space in such a way that you maintain physical distancing? How do you cue people and choreograph what's happening with the audience as much as gets choreographed on stage? And then last is PPE, and here would be the use of, let's say, masks. So the last thing I'll say before, I turn it back to Diana, and happy to answer as many questions as you have. But the idea here is it's a layered defense approach. Not one of these control methods is sufficient by itself, but together we can create a pathway towards minimizing risk. This is very similar, if you think about it, to what is done in the security industry or the cybersecurity industry. There's no fail-proof system, but if you layer enough defenses, you can get to a place where it's not zero risk, but you can minimize risk to a level that, one, you feel comfortable having people back in, and also your guests feel comfortable about coming So I'll end there. I think I covered a lot about the background, the basics of the science, and also the framework we're using. And then, of course, it gets into the fine details. But it's a useful framework because one of the biggest challenges I think I see, and maybe others do, is that there's so much information coming at us so fast. It's hard to see the signal through the noise, and it's hard to decipher the science and what's real. So we hope this is a useful framework for you as you start to think about your plans. And I'm happy to be a part of this and share what we learn with everybody. The goal of here, of course, is not to have a plan for ART and Harvard, but it's a plan for the hopefully the wider community. Thank you.
So if I could just jump in to follow up on this, maybe we could go back to off the slide so we can see each other. Before we go to questions, just a couple of follow-ups to that. I think for theaters, what we've been discovering in our discussions with Joe, there are certain things that are ongoing considerations that we can think about taking care of, specifically analyzing the ventilation systems in our theaters and facilities, what Joe mentioned, looking at the performance of your filters, airflow, air quality. So we've been doing that actually at ART, even in this moment of shelter at home. We've just been starting a process of analyzing the air quality in our theater and just finding out and figuring out what we could change, what we would want to change, how to change it. There are systems of cleaning and protocols that we can start to think about just even for the moment when small workforce is allowed back in the building. The larger obvious question for all of us here is, how do we get back to our practice as performers, artists, administrators, producers? So just to let you know what we're doing at ART is we're trying to kind of break out all those categories from pre-production, rehearsal practice, performance practice, including back of house operations, front of house operations, the audience interactions, and of course the communication strategies around all these, because one of the first things that Joe had said to me was the interventions are important, and you've got to understand they're going to be interventions that are visible and some that are invisible, but you're going to want to communicate to your audience, to your staff, to your artists about what you are doing, because I think the backdrop that we have to acknowledge here, which I think maybe as people in the creative field we're very tuned into, there is a backdrop of anxiety, there's a backdrop of fear, and always first principle, health and safety, but the reassurance that we're going to need to establish for ourselves, for our workers, for our artists, and then ultimately for our audience will be equally important to the interventions we're actually taking on. Of course, it's very hard to plan for what we can do. You know, I'm sure all of us are actually processing what we just heard, that, you know, no events for more than 10 people for the rest of the summer. I know there may be nuance to that, but it's hard to plan when we're not clear on what we can plan. I can just say that what we're going to do at ART is start to think about maybe an outdoor show. This is something that we discussed with Joe and his team, that outdoors could be our friend in terms of air quality and ability to social distance. So rather than think about how do we get back to that full-on operation with that big show with the full cast and, you know, a full house, that feels sort of daunting to consider right now. So we're starting incrementally, and that ended up being a guiding principle is, can we work incrementally? Can we think about first steps, projects that feel the most manageable, where we can learn by doing? So for us at ART, that's going to be planning for an outdoor production We have been speaking with Ned Friedman at the Arnold Arboretum. I know Actors Shakespeare Company has done shows there. We're thinking about a show that we're specifically conceiving of in this climate. So it's not a show we would have done and we're just kind of finding a new home for it, like a ground up show that deals with all the principles of public health. So actually the show is more of a kind of a laboratory experiment meets performance that would be a partnership with the Chan School, ART, and the Arboretum. And in a way, it will be a first attempt to put some of these principles into practice when we're allowed. And hopefully what we learn from that, we could share with the field. I think lastly, what I just want to say is the focus that Joe has encouraged us to take is not, we must open, but rather optimism that we will open. So how do we figure out a process towards reopening? The timing piece, I think it's sometimes helpful. We found it helpful at ART to disengage the timing piece, because if you get hung up on the timing, it's very hard to get out of sort of a deepening black hole of like so many factors you don't know. So rather than thinking about timing, thinking about what we would do and maybe thinking incrementally and small steps. Now that may not be the business answer for a lot of us on this call, incremental small steps, outdoor shows that are done, maybe for free, as we are thinking, those are not going to solve our financial pressures. But they're a step forward towards, in a way, showing our resilience, showing, I think, really important, what Emily said about getting in front of the government, the mayor and the governor, to say, as a sector, we are thinking these things through. There's work that is being done, that we know how to take safety carefully, and that it shouldn't be a on-off switch, that just because we're theaters and we tend to have large crowds, that we should be at the back of the line in terms of reopening, but rather, can we as a creative field, because we are creative, be nimble, flexible, dynamic, pivot to new models? So the new models is also a topic, I think, that we're going to try to include in the roadmap and encourage for organizations that, can find ways to pivot to new models. So I don't know if you want to add anything, Joe, or Pascal, if we want to go to kind of question time for the rest of the hour.
Joe, do you have anything?
No, that's great. I'm happy to, I think Diane summarized it nicely, so happy to answer questions.
Great. Our first question, Joe, what does improving the ventilation look like in a building?
Yeah, so, really nice question. And, I also saw an earlier comment too, and I think I wanted to dismiss a misnomer that is out there, that only, shiny new buildings can be healthy buildings. I'd say in all this forensic work I've done, taking the worst of the worst buildings you could imagine, and just with a little bit of attention, can turn them into high performing buildings. So in terms of ventilation, right, again, we think about the modes of transmission, what we're trying to guard against. So ventilation would target that airborne transmission route. By bringing in more fresh outdoor air, 100% outdoor air, you can dilute indoor contaminants. Right now, our buildings have been designed, most buildings historically are designed where we've choked off the air supply, right? Architect Norman Foster talks about breathable buildings starting in the 60s. Well, we went away from breathable buildings, really. So the code minimums right now are not enough. They're set for energy, which is of course important, but they're not set for optimal health. So if you increase the amount of outdoor air, that's a good thing. Most buildings also recirculate a percent of the air. So you can imagine that could move contaminants from one area to another. So what you want to do is have a high efficiency filter in that return air plenum up in the ceiling or in the return ducts. Because if you get a high efficiency filter, you can get particle capture efficiencies anywhere from 80, 90, 95%. And viral particles are small, but these filters do a really nice job of capturing the particles. So it's actually a pretty cheap fix to bring in a little more outdoor air, increase the efficiency of particle filters. You'll pay a little bit of an energy penalty on the pressure drop. And you can talk to your facilities team about this. But one of the first things you can do is just first and foremost, get a sense of what your systems can and can't do. There might be physical limitations, and maybe you can't enhance your filtration to a MERV 13. Try to get to that MERV 13. That's a rating, MERV 13 or higher, and see what your building can do in terms of bringing more outdoor air and higher efficiency filters.
We have another comment from Catherine Carr-Kelly. Most newer theaters are built to move large volumes of air quickly through huge vents. Is this helpful?
Yeah, so it's going to matter. Again, nice comment and question, right? So it's not just the overall flow of air. We think of volumetric flow, the amount of air that comes into the room, but how much of that is outdoor air. But you can deliver a lot of air if it's recirculated too. So you want to concentrate on how much outdoor air is coming in. And so if you hit above these standards, that's a good thing. You're filtering with your recirculated air, like I said, that's good. And the last thing you want to think about is air movement, right? So where is how is the air either pressurized or not pressurized, the different rooms and the airflow between the rooms. And here, somewhere like the bathroom becomes really important. So you want to have high exhaust in your bathrooms. This is an area you should think about for your ventilation system. Are you exhausting that air sufficiently? Because we know this virus is detectable in stool for several weeks after people are symptomatic. And when you flush toilets, you generate bioaerosols. So the ventilation in the bathroom is particularly important. And so is that pressurization, making sure that the air is moving into the bathroom and out rather than the other way.
So we have a comment from Eva. I'm curious to hear more about the development of the roadmap as well as testing new kinds of work and what opportunities these may present for collaboration among the Boston theater community at large. I'm not sure if that's a specific question to y'all, but it is something we should all think about. Related to what you were just talking about, Joe, at the Umbrella, we just installed a displacement air system in the theater. It comes in low and exits high. Does this help?
Yeah, so displacement ventilation, actually, technically what we call it, you get a greater ventilation effectiveness. So for the same amount of airflow, you get a lot more air movement happening in the space. It also frees up some things depending on how the system's designed. It might even be more localized. So you're dispersing and diluting indoor contaminants even more effectively. So technically in the guidance documents, if you have displacement ventilation, you get a bump, you get a credit for having greater ventilation effectiveness. So it can be good. I think with all things, it's hard to say a general statement. It depends how it's done and how well it's implemented.
Can I just interject here for 1 second, Pascal? Because I think,
Yes.
Joe, you've spoken about how, often buildings open, they've got a rating, or they don't even have a rating. They just have, certain things they've done. But they don't, the maintenance of buildings is as important. And, a building can be healthy and then a building can get sick. And, the idea that we don't have a rating system on our buildings that, that might be something that audience going, a public might crave to know that a facility has a certain grade, like the sanitary health inspections for restaurants, that the audience knows visibly that this theater has been checked, that the air quality is at a certain level, et cetera. I don't know if you want to speak to that.
Yeah, Diana, it's a really big point. Diana and the teams have been talking about this a lot, that one of the most important parts of this is being able to effectively communicate this to a wary and anxious public. There are going to be things they see that will be overt. Okay, the queuing of people, the cleaning, yes. But there are going to be things that should be done in the building that they won't see. And you're going to have to communicate that back to the science. Here's what we know, and here's the control strategies. You won't know that there's more air coming. You won't know that we increased the filtration. And in terms of that certification piece, it's a really good point, because I think most people are surprised to know that buildings, we design them and certify them that way, but then not on a performance standard. So even if you're meeting these minimum standards on any of these factors, buildings change every day. And if we were all together, they change by the hour. And so if it was designed one way 20 years ago and hasn't really been commissioned or looked at closely, it's very likely, in fact, I'd say it's a good chance that it's not performing even to those minimums, because they change over time. So this is where just doing giving your systems just a little bit of love and checking in on them right now to see really what you have, and is it functioning as you think it is at first, and then what can you push it to make it an enhanced control mechanism as opposed to a minimally effective control method.
Joe, can you speak a little bit, and Diane as well, you talked a bit about disengaging the timing part in these conversations, but can you give any sense of the scope of timing that you are working off of? Has Harvard announced a plan for classes or gathering in the fall or spring?
Harvard has announced that the college will be in operation, whether it's in residence or not, they have not decided. So we are all awaiting word for that. So we are, I think that question was from Temple, we are in that land of unknowing.
Sure.
So I think, like all of you, we're building multiple scenarios of thinking about, what we could do if we're allowed to reopen and gather in September, December, January, and not thinking much further off than that for now, just because we're hoping it will be one of those three, if not later into the, next year, 2021.
Yeah, I'd say one of the things I'd add to that, as we think about, of course, we'll follow the guidance from the federal, state, city, and also Harvard, these institutions. And we're also tracking the science really carefully. And Dan mentioned it right in the beginning, that the idea of this roadmap is that it has to be flexible because the science is changing. The disease dynamics are changing. Certainly it'll be very different by June, as July and August is entirely unpredictable at this point. I'm hopeful there's reason to be optimistic that we will get some breakthroughs and we can hopefully change this kind of course we're on here. But the plan is not just a plan like a typical disaster where it's, a hurricane or something, you pick up the pieces and march along to recovery. The plan might advance, and then as things change, we have to all recognize we might have to take a step back or hold level at a place where we can show we can manage risk successfully before, we have a gating criteria before you can go into that next phase. And before you take that next step, you show that you can manage this, and it's being managed outside of our control regionally. So there's a lot of factors that go into it, but I think it has to be, as Diane said, part of the plan is that we have to be dynamic and responsive to totally unpredictable next couple of months.
Joe, can you elaborate on the risk levels of outdoor events and what engineering controls might be useful there?
Sure. I mean, I've been talking and writing a lot about this too. We have an op-ed, I think it's in the Washington Post, with Mark Lipsitch at my school and Ned Friedman at the Arnold Arboretum, arguing and making the case that our parks should stay open. I worked with the Boston Globe editorial board on their editorial just, I think it was yesterday or the day before, arguing for parks and beaches can be opened if it's done safely, because the risks can be lower if they're properly managed. Here's where I think is really key here is that, the only way for this to work is everyone's going to have their responsibility, right? ARTs, in this case, going to have their responsibility to do their part. As people come, individuals are going to have their responsibility. And if people do their part as well, everyone's going to have a role to play here. And this applies for beaches and parks and everything else too. Then we can keep taking that next step. But if we can't manage this responsibly and everyone doesn't do their part, then we're going to lose that really privilege of being able to get back to the things we know and love to do. So the reason I brought that up is because the parks work and the outdoor, it is grounded not just in, again, Joe's opinion of what I think should happen, it's grounded in the science. And the science shows that when you're outdoors, the risks are lower if you maintain physical distancing, but also because you have endless dilution, and even airborne contaminants or close contact can dilute out faster. So Pascal, if we were near each other, still we'd want to keep that distance. But if you were a little further away and I went walking by or jogging by, it will dilute any aerosols. So it is safer. I do think, though, if we think about an outdoor event, it doesn't mean we're not careful. We still have to apply all these layered defense strategies. It's just that it takes away a couple variables, right? Maybe we have more space we can spread out. We're not so on top of each other. We don't have to worry about ventilation rates and filtration and the like because we have perfect ventilation.
Can you give some guidelines for a group putting in a new HVAC system?
Sure, I could talk all day about HVAC. But really, how about this? I'll point you to the right place. So,
that'd be great.
Yeah, there's an organization called ASHRAE, A-S-H-R-A-E. It used to be American Society of Heating and refrigeration, I don't know, engineers, right? So anyway, these are the group that think about this all the time. And they put out some great guidance recently on what to do with your mechanical systems, how to commission them, how to operate them, related to COVID-19 specifically. This is also the group, unfortunately, that put out the guidance that says our building should have a minimum ventilation level. So I have a real problem with them most of the time because they don't really think about health. But as it relates to COVID-19, they have put out new guidance that says, here's what you should think about from an infectious disease standpoint in terms of how to engineer your systems. So we can point to that link, but it's ASHRAE, ASHRAE.
It's in the chat right now. Rebecca just put it in. So if anybody would like it, please click in the chat. A couple more questions. Joe, we're wondering about your take on the open concept versus cubicle offices. A lot of us have very different office spaces, and what you think we should be thinking as we're planning this reopening.
All right, so I might have a opinion that is not common, but I don't think it's the end of open floor plans. I really don't. I think, like anything, it's hard to generalize and say any approach is inherently risky. I think probably, like you've all seen, there's a good and way to bad do it even before COVID. I've managed risks in these kind of environments. I just think you have to align your control strategies for that. So if that means open floor plan, maybe putting up smaller barriers, not total cubicles that would prevent large droplets, bringing more outdoor air and enhancing the infection and disinfection protocols, staggering. So Pascal, if we're face to face, if we just offset a little bit, that does a lot. If I cough, you're not getting the direct spray. So I think, to me, it doesn't mean the end of this. I just think it's something we have to pay attention to and manage the risk. Just like theater is different, right? It's just a different thing. It's different than hospitals. It's different, but in a lot of ways, we're talking about the same things because we get back to that the grounded in the fundamentals of the science and how to protect workers and guests.
Cool. I think we have two more questions before we wrap up. And this is for mostly Diane, but does the roadmap extend to producing works for audience of less than 10? Is this the time to pull out the really boutique work? What are your thoughts on what producing could be like in this time?
Yeah, I think, yes, we've talked a lot about facilities today, but I think the roadmap is really just some framework for thinking, and it should be able to be applied to small theaters, organizations that don't run or operate a facility. Frankly, I was really feeling very passionate about high school theater departments across the country. Like, let's say high schools reopen, but then the drama department is kind of feeling like, well, we can't do a play because that's not healthy. What can we offer of guidance and kind of, as Joe said, layered defense interventions to make the situation safe and healthy and offer a way back. I think pivoting to new models, I cannot underscore how I think this is the moment. That doesn't mean that this will replace theater. I know a lot of people have asked me, like, will there ever be theater? I think there will be theater. It won't go away. It's a human need. Everybody here knows this on this call, so I won't say more about that. It will come back, but we're in an acute phase, and we're going to be in an interim phase, right? With potential second, third waves. We've all read those articles. So we're going to have to be flexible. And I think the more we can, as a sector, demonstrate our creativity and our flexibility and think about smaller events, shows that can be thought of in pods, so that if there were some kind of health situation or outbreak, it could be controlled. I mean, there are many, many ideas, I think, that we could all brainstorm on. And I think, the more ways we as a sector can offer models, we can help each other in terms of ideas for how to, engage with our artists and our audience in incremental steps.
Do you all have an idea of if the roadmap will have a framework for organizations who don't own or run their own spaces, but want to support the larger ecology of the theater and gathering economy?
Yeah, I was sort of thinking about, I had read that question in the chat. So I was sort of like trying to get my last response into that I think hopefully the framework will offer people a way to take it and apply it to whatever kind of institution you are. Again, just to be really clear, we're not at all saying like, here are the solutions. It's really more, here are principles, here are ways of thinking, here are some ideas that we're going to implement as kind of offerings to the field.
Joe, we have another question that's specific about social distancing, and there was a question of if you start to think in terms of what distance is safe distance for sitting in the theater. Is there a square footage recommendation coming into view?
Yeah, so it's a good question, and I actually wanted to tie it back into that hierarchy of controls. I don't want to lose sight of that because we did talk a lot about the building, and the building is under engineering controls, right? But there's 5 other parts of this hierarchy, and this one falls under more of the administrative controls, and they're all equally, they're as important. So there are things you can do to maintain physical distancing, particularly as we think about this phased approach, where you could de-densify the theater. It's not the economically viable path back, but it is a path to getting back and getting all of your other systems in a place where you feel comfortable enough to then start increasing the audience, the number of people in the audience. You know, why the hierarchy is interesting is that the least effective and last resort is PPE. And we use this in any industrial setting or office setting or a school, anywhere, in that you try each approach in the hierarchy. And if you can't control it, then and only then do you resort to PPE or personal protective equipment. So if we get it to a point where we have everything under control as best we can, the cueing, the choreography with the audience, the back of the house, everyone feels good, but we still can't limit that physical distancing, there's nothing we can do about it. And unless we just have half audiences or whatever, but we start to get back to full, it may come to the point, I don't think it's that far-fetched, that people will be wearing masks. You know, if you want to post this, I wrote an article at least a month ago in Washington Post arguing for there's a 4-fold public health benefit to mask wearing, even homemade 100% cotton masks. And so it can act to, first and foremost, it prevents the wearer from infecting others, right? It's a physical barrier to block aerosols from a cough. So this is something, you know, Diane and our teams have talked about. Right now, it's everything we can think of is getting considered. First and foremost, can we keep everyone safe, and what does that look like? And only then could you start to think, well, what could we pare down or not do? But first, we have to do this. I think mask wearing will likely be a part of this, certainly in the queuing and in the entry, and people should be wearing them on their way to the theaters too.
Okay, we do have just a few minutes, and unfortunately, we do have to end right at 4 o'clock. I know we still have some questions in here, but I just want to thank Diane and Joe so much for joining us today and giving us some time to talk through the plan. I know you both have mentioned it is an ever-evolving plan, and this isn't the end-all be-all, but it is a place for us to start. So thank you both so much. I want to pass over to Cara before we end.
Can I just say, Cara, quickly, thank you, Pascal. Our initial framework for this will probably be going on our website. It will be linked to the Chan School, and we're aiming for the end of next week. And there'll be a prompt on the website for ways in which to continue conversation and you know, continue to address all these excellent questions that are coming. So I know we have to end today, but I'm hoping there'll be a way via the website for continued important dialogue that will, as we've said over and over, continue to be informed by the changing landscape.
And Rebecca Curtis has placed her information in the chat. So if you have any questions, please connect with her. Her email is there. And she's also put the link to the site as well if you are looking for that direct link. Awesome. Cara?
Well, yeah, no, I have to say thank you so much to Diane and Joe for sharing all of this today. And I think you can tell from the conversation how hungry we all are for some sort of order to all of this uncertainty and for some technical answers to these questions. So I think this has been super helpful, and we're really looking forward to what comes out of this. And I hope that for everybody on the call, you know, as we're moving forward to what can local government do to support reopening, I think that hopefully this has really triggered a lot of questions for you about what information you need and what do you need to have in order to apply this framework or to take some of these steps. Is it technical assistance around some of the really technical things like HVAC and some of the building specific questions? Is it technical assistance that's really more about applying a framework or being able to articulate a process so that's something to work through? And I think also as people are adapting their programs, is it help thinking through the framework for why you're adapting and to what? You know, is it to stay engaged with your audiences? Is it to do something more experimental where you're reaching new people? You know, is it to stay on the radar, or is it actually to make money? Which could all be really different kinds of strategies. I think one thing that seems to me like a pretty clear ask that everyone should be asking of me and of the city is help with standardizing the communications around what steps are being taken, whether you have a venue or you're going into a venue. You know, even for something like Main Streets, you know, there's a set of kind of city branded signs that go up that say, here's what's going on, here's the steps that you should take. Like, what's our sector industry version of that, so that audiences can see something that's immediately recognizable and kind of standardized that helps inspire that confidence that the right steps are being taken. So lots to think about. Please mull on this, and next week really want to hear what folks need in order to move forward. And yeah, so thank you. That was a great conversation. Going back to the announcement from the top of the hour about canceling, having to cancel events, no events over 10 people. I'm gonna pick at that some more and probably email everyone hopefully by the end of today with just some more information about that, and hopefully some more detail. And yeah, hopefully by the end of today, if not today, over the weekend. So before everyone kind of runs out panicking about their outdoor events, let me do a little bit of digging and just make sure that we have everything for you now that we can. And so I think that is it. Thank you,
Awesome.
everyone.
Thank you, everyone. Just a reminder, we will be posting this recording of this meeting on the boston.gov website. So if you want to look it over there or share with anyone else in your constituency, it'll be up there probably Monday. We have to give the time to upload it. And we'll also be sending the PowerPoint to everybody who registered. So look out for that in your email as well. And if you have any questions, please feel free to email. And thank you all so much for a great meeting, and enjoy the rest of your weekend.
Thank you.
Thank you all.
Thank you. Thanks so much, Diane and Joe.
Thank you.